Good afternoon, everybody. I am pleased that you could all join us today as we announce 3 new initiatives to help our community health centers provide better care to people in need all across America.
Today I had the honor of representing the AAPA at an announcement by President Obama at the White House regarding over $500 million for community health centers. These monies will go to fund reconstruction and rehabilitation of their facilities, will support technology, as in their electronic medical records and other information technology, and also to fund a medical home demonstration project, which is very important to PAs given healthcare reform legislation. We're working very, very hard in the current healthcare reform legislation that Congress is considering at this point to make sure that PAs are named in all new models of healthcare delivery, such as the medical home and chronic care management.
A demonstration project to evaluate the benefits of the medical home model of care that many of our health centers aspire to. The idea here is very simple, that in order for care to be effective, it needs to be coordinated.
There were many, many representatives there from Congress, the Senate, people who work at community health centers or are administrators at community health centers, and this was very well received. They've given 85 grants to various community health centers across this country. These community health centers are critically important to care. In a community like mine in Bakersfield, the community health centers there are a very important safety net program to make sure that people have access to basic primary care. And we can't do without it. I'm very, very grateful that the President has chosen to include a significant sum of money in support of these critical needs clinics in our communities.
And I especially want to recognize the leaders here today from health centers across the country for what all of you are doing in your communities every day.
I was very grateful and honored that the President chose to include PAs in this important announcement. These sorts of things demonstrate that he feels that we're important within his plans to reform the healthcare system and recognizes the incredible contribution that PAs make each and every day in their communities and many, many of us who work at community health centers. And so I was very grateful that we were included along with family physicians, the American College of Physicians, and a number of other medical groups. I have to tell you, it was just an incredible experience going to the White House. It was my first trip there. When the President was announced, it was like we were at a rock concert. Everybody cheered and was incredibly grateful to be included in a very small group of approximately 130 people. He understands the importance of community health centers. He understands the importance of PAs and others who deliver health care within the community. And it was just an incredibly exciting experience for me. It's one that I'll never forget, and I hope I get a chance to do it again.